It is another interesting edition of your favorite program, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to finding lasting solutions. I am a regular anchor, Shomowa Daniel, saying you're welcome. Our focus for this week is on skin bleaching and its numerous health implications. Please stay tuned, don't go away. We'll be right back after the news segment. It was the 12th symposium of the Health Writers Association of Nigeria, EWAN. Having recorded more disease outbreaks in the year 2022 outside the COVID-19 pandemic that the world is yet to recover from, the theme, Emerging and Re-emerging Infectious Diseases, for speakers was very apt.
The theme of this program is very, very germane. And I also want to commend this association for the efforts we put into it when COVID-19 was ravaging the whole world.
The lessons we have learned is the fact that we should be prepared, like the Boy Scout or the motto of the Boy Scout. We should be prepared in terms of emergencies, in terms of universal health precautions.
Keep off foods that have high salt intake. Keep off pickled foods, foods that contain nitrites and nitrosamines, e.g. processed meat and red meat. Keep off such foods.
In the face of rising cases of non-communicable diseases, speakers act on the enforcement of health insurance to reduce the burden of out-of-pocket payment.
We are going to roll out IEC materials in the new year. There are plans of establishing NHIS Claim Management Center. This is going to be a very critical innovation by the authority.
The cardiovascular diseases, the hypertensions, the strokes, the diabetes, the cancers, the mental illness. Those are non-communicable diseases that are at epidemic proportion. Some of these diseases can be prevented and some can be managed. And with insurance, you are better placed to be able to manage those diseases.
You see people dying. They are not dying because they don't know what is wrong with them, because they don't save up for treatment. People say it's well, but you have to save for tomorrow, because you don't know what will be tomorrow. You don't know whether you will be the next patient. That is why the issue of health financing is important. Take up health insurance.
Addressing the welfare issues of healthcare professionals, an increment in the budgetary allocation and improved budget performance also came to the fore. Genome editing is a technology that has been in existence but however has not been practiced in Africa. With this gathering, experts are discussing the modalities to kickstart the initiative.
A lot of mineral resources, natural resources. We will also use the technology to transfer in healthcare issue, because most of the things we buy from overseas, they come here to take it, research on that, and send back to us. Moving forward, we have to research our own products in terms of healthcare, use it, and export to them, not we importing from them again. With what we are doing today, any illness we have, we are going to crush it, because we have all it takes here.
Well, it's not only healthcare. You understand, it cut across. The gene editing is a technology that is going deeper to be precise, to get to the root of a problem and solve that problem. Material that is any material that is in existence. I mean, in terms of human, animal, it has a gene, and the gene is the root of all the properties in terms of behavior, in terms of whatever you can find of in human. So you go directly to the gene and modify what exactly is causing problem in terms of diseases, in terms of other aspects.
Participating countries in the project include Nigeria as the host country, Burkina Faso, Ghana, Ethiopia, and Zambia.
Information will be mirrored, and information that is not universal, they can pick it up from one another, and also it will help them to network. So that instead of them networking with outside the continent, they can network within the continent and focus on the crop of importance. In Africa, we have 6 of these crops is in the pipeline. It's not yet in on the field. It's not in the farmer's hand, but they are working. And this is an African scientist that is working. For instance, I speak of Nigeria, to be precise, because they are hosting in Nigeria. National Root Crop Research Institute, Omodeke, they are working on cassava. And this cassava is the livelihood. If you are from the eastern state, even in your part of Africa, you cannot live without cassava. And so they are working on it to make it better and using the technology to improve the livelihood so that the yield that we are getting presently can improve.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Welcome back. Recently, the World Health Organization, WHO, ranked Nigerians highest in Africa, especially women, for the use of bleaching creams by 75%, followed by Senegal, 60%, Mali, 50%, and Ghana, 30%. Skin bleaching or skin lightening is a cosmetic procedure that aims to lighten dark areas of the skin. Although there is no medical benefit for the age-long practice, many take to skin bleaching for cosmetic reasons, amongst others. In time past, the available option was the use of both the creams that came with the risk of dark patches in some strategic areas of the body. But with advancement in science, several options, including injectables, are now available for use to change body color from within.
The issue of bleaching cream has become not epidemic, but rather pandemic. We do acknowledge the fact that it's not restricted to Nigeria alone. It has become a global problem.
People use it basically to change their color because they do not want the skin color they have. So they use it to change their color to a fairer skin. It comes in different names because of negativity that is attached to skin bleaching. Those days they call it skin lightening, skin fading, toning, exfoliating. But whatever name they call it, it's still the same thing, changing the color of the skin. Media could help NAFDAC to still take this message out to the public that black is not ugly and white is not better.
A recent WHO report estimates that by the year 2024, the skin bleaching industry will be worth $31.2 billion globally, with Nigeria ranking highest in Africa by 75%, Senegal 65%, followed by Mali.
You have them coming as creams, soap, even injectables, peels, laser therapy. You even have some chemical peeling. So they apply it on the skin and it goes deep into the melanocyte, into the epidermis, and it will just change the color of the skin. So there are lots of ways people apply it these days. A lot of them because of the melanocytes that produce the melanin that protects the skin from UV rays, also gives the body the darkness it has. So when those bleaching agents are applied, they destroy or inhibit the production of melanin. And so because melanin protects the skin from ultraviolet rays, when melanin is inhibited, the production, it exposes the skin to UV rays from the sun. So when the person is exposed to sunlight for extended period, you find that the person is prone to skin cancer. Besides skin cancer, there are lots of also health implications like kidney, liver diseases. It can also lead to ochronosis, where you have black blue patches all over the body, all over the skin.
We have endocrine disruptions, we have hormonal imbalance, we have malformation of fetus, malformation of babies, a lot of health implications, cancers of different type, death, onchosis, darkness of the skin, and so many things like that. We're asking people to be informed. We're relying on you to help take the message and all that you learned today to everyone. Take makeup off your face before you sleep at night. Wash your face thoroughly. Make sure whatever you're using, it has to have an ingredient list. You know what is on it. You know the banned chemicals, mercurials, corticosteroids, things you shouldn't use without prescriptions.
Another issue of concern is the use of dangerous chemicals like snipers for food preservation.
Naturally, pesticides are used to preserve food. They protect crops and agricultural produce from the harmful effect of pests. It's a natural thing that is being done all over the world. But far beyond that, what is being done in this part of the world, especially in Nigeria, is that these pesticides are directly sprayed into food that are being sold, not the one that are stored in silos, but the one that are being sold directly in the market. There are a lot of issues and instances of even fish, dry fish, and even fresh fish being sprayed with sniper, DDVP, or diclovos, and other pesticides. And we have issues that these pesticides have been sprayed on beans and maybe maize and other grain products. The reason is because they say there is flies that are affecting it. And the problem of fly affecting it or touching it is that the flies will lay eggs on it. And once they lay eggs on it, because of the dampness, like in Lagos is a highly a humid environment, highly humid. And because of that very one, a lot of water vapor and the rest of them deposit on this thing over the night. And then once the flies comes in and lay egg on it, they will hatch and then produce the maggots and the rest of them. So, and it will cause spoilage. So to avoid that very one, instead of drying it, naturally drying it and making it that it is dry, they will rather spray these chemicals on it. The same thing goes for the use of these same chemicals, some of the chemicals, to ripen fruits, like calcium carbide. Calcium carbide has two problems. The first one, that the gas that calcium carbide is producing is called ethane gas. Ethane gas just mimics ethene gas. Ethene gas is the natural gas that is responsible for ripening of fruit. So this ethane gas mimics it, and it doesn't really ripen the fruit. It helps to maybe make the skin of the fruit to be ripe, but that does not now mean that the content, that is the inside, that is the real fruit inside, is actually ripe. And that is why you can buy a banana that you have the skin looking ripe, but when you cut it, it is completely unripe. You will not be able to eat it. But these items, apart from what I've just said now, calcium carbide also have two natural contaminants that are there. One of them is arsenic. The other one is phosphorus, which are very, very toxic. The two of them are very, very toxic. If you buy meat, or you buy fish, or you buy corn, or beans, or even rice from the market, any market, the first time, wash it with water as usual. Then, before that very one, after you have washed it, if you are cooking, if it's beans or rice, the first water, throw it away. Don't just cook it like that, maybe cook it right and be just join it together and going to cook. No. Throw that first water away, parboil more or less, wash it, and then cook. If it is meat also or dry fish, use warm water or hot water. I didn't say cook it, but use warm water or hot water to wash it, because to an extent, the warm water or thereabout will remove some of those chemicals that are there. The same thing goes to some of our vegetables. Like all these vegetable pumpkin leaves and the rest of them, foriro and the rest of them that we buy. This one, wash it with warm water, because some of them are directly sprayed with all these pesticides before they were plucked. That same time they were plucked, they were sprayed with all these things. So if you wash them, it will be okay. Then for the one of using calcium carbide, please be very, very observant. Any fruit you see that something like dust, you see dust particles on it, that is showing that calcium carbide is used on it. Don't buy it.
If you are just joining us, it's Health Affair on AIT. And next on the program is our nutrition segment.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folic content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation, reduces bad cholesterol, levels the risk of diabetes.
On our clinical segment, we give you tips for healthy living. We value your contributions on our perception segment on how to improve human lives.
But I keep on telling people, if you know that you can become a victim of this, why engaging into it? If someone, maybe you're making a fake drug and you're making billions smiling to the bank, tomorrow it may be your father or your mother that may use that drug. It may even be your last son or the only child you have. Maybe they want to use it and you succeed in killing it because you may produce the product here now and before you know it, it's any part of the world, any part of Nigeria. Maybe your son got to that place and has a hate issue, and lo and behold, they inject your son with your own poison. Nature will never forgive you.
This is how we wrap it up today. Thanks for staying with us. Let's do it again same time next week. And don't forget to advertise your health products and services on the platform. We'll do it for you at a subsidized rate. Please keep staying safe. I remain yours truly, Oshomowa Danis.